Good afternoon, everyone. I'm very happy to be speaking with you today. I'll start with just telling you a little bit about Elevate. We have been in revenue cycle management for over 45 years with lots of experience across our leadership team and have over 3,000 employees. And one of the things we're most proud of is being a great place to work because those employees really do make a difference. And so we invest quite a bit in our employees. We're also very proud of our client retention, and we do that because we have great partnerships with our clients, and we endeavor to do that for long term, not just short term. And we believe those two things, really that experience and that client retention, because of those great people, are what makes us the best in class service provider for eligibility services. So today we're going to be talking about the OB3, as some people may refer to it, but the big beautiful bill and the impact on some of the healthcare provisions and some of the impact that that's having on Medicaid and marketplace enrollment. And then we'll discuss, after we go through those things, then we'll discuss some mitigation strategies to help affect those things that are going to be negative. And so we'll try to do some things that will help to mitigate that and not have as severe of an impact. So we'll talk about how we can get there. So when we look at the bill, if we wanted to summarize what were the major impacts of the bill, what things really are we going to see as a result, we would narrow it down to really three things. The first thing is that there are definitely people who are going to lose coverage. And that is because sometimes when you have people who are not in healthcare, making legislation about healthcare, there are unintended consequences that oftentimes the providers end up being the ones who have to hold the bag. Well, in this situation, it's not an unintended consequence. One of the main goals of the healthcare provisions are to reduce the people who are on Medicaid because those things are actually being used to fund other parts of the bill. The second thing would be just everything is getting harder. They're requiring more verifications. They're requiring that the patients and applicants will have to provide in order to get Medicaid, and they're making more hurdles and hoops for people to jump over and through in order to get coverage. And then the last thing is that with all of those things that they're adding on, they're giving us less time to do it. So that those are the things when you make the process harder and you give people less time to do it, that you generally result in fewer people getting on benefits, and some things that will even result in individuals that will in losing benefits that they are. So when we look at the marketplace plans, which this is the provision that was that had the government shut down. The fact that there was not a provision added to the bill to extend the enhanced subsidies for marketplace plans is one of the things that is currently under discussion. And although the government has reopened, they still have not come to a consensus on this matter. The Democratic Party is supposed to be putting together a proposal that will be reviewed in December, and hopefully they can get bipartisan support to maybe add those subsidies back. But at this point, we don't know yet because the conversations they've been having really were at a stalemate. They had not been able to come up with something that could get the votes. So we're looking at what right now is planning to happen in January. Those subsidies, at December 31st, those subsidies end. And so in January, we won't have the enhanced premium tax credit. And to get an idea of what that looks like, if you go put your memory cap on and go back to when the marketplace was first initiated, one of the biggest complaints was that the plans were unaffordable. At that time, we still had premium tax credits. We still had cost sharing reduction that were written into that law, but they weren't enough to make it where it was affordable. Then fast forward, the enhanced subsidies and enhanced premium tax credits were added. And that made it so that even people who previously qualified for premium tax credits were able to receive more subsidy. And in some cases, we have many individuals that actually have no premium. They don't pay anything because the enhanced tax credit actually covers it for them. And then for many others, it brought premiums down to reasonable rates, $35, $45, many less than $100. Now, what we are anticipating to see is at least a 75% increase. Many people are seeing their premiums quadruple. And so that's going to make it unaffordable for a lot of people. The other piece is that as a result of the bill, there are individuals who previously could qualify for marketplace plans, such as DACA recipients, that are no longer eligible to qualify for marketplace plans. And to add insult to injury, with the premium tax credit not, that enhanced tax credit not being available and seeing that increase, it's actually compounded because plans were already set to increase. So you can see across the board, commercial plans, even in employer-sponsored plans, are seeing an increase in cost going into next year. And so those two things together really make a big impact on individuals. So when we look at what's contributing to that increase in cost, a lot of the feedback that's coming from the carriers is that there's increase in their costs, and they don't eat that. Generally, that's going to get passed on to the consumer. And so with the increased use of some of those GLP-1 drugs, I'm sure probably everyone on the call either knows of someone or knows someone that is using either Ozempic and Wegovy. They're seeing a very high cost increase with the volume of people leveraging those drugs. And then labor costs and shortages. It's costing more for people. And so anytime you see those costs go up, then that generally gets passed on to the consumers. The other piece is that there is a concern given, and this is from the carriers, given the changes that we're seeing in Medicaid coverage because of how many people that covers, that people who end up going into the marketplace will be people who need that coverage, and they're expecting that to be people who are less healthy. And so if the people that the insurance carriers are covering are less healthy, that increases their cost as well, which they're, of course, trying to anticipate that with the increase in it.